I want to talk to you today about something a great many older adults experience and tend to brush off. And that occasionally carries an important message about the heart or circulation. Dizziness, that feeling of being lightheaded, woozy, unsteady, or as though you or the room are spinning. Because dizziness is genuinely common in later life and very often has benign or simple causes, so people tend to shrug it off, but sometimes dizziness, especially certain patterns, can relate to the heart, the blood pressure, or the circulation, and is worth understanding so you know when to be reassured and when to get it checked. So today I want to clear up the confusion about dizziness, explain the many things that can cause it, including the heart and circulation connection, the patterns and accompanying signs that matter, and when to see your doctor or seek urgent care. And I'll keep this calm and balanced because while much dizziness is benign, some carries an important message, and understanding the difference lets you respond wisely, neither panicking over every wobble nor dismissing the patterns that matter, in partnership with your doctor. As always, this is about sensible recognition and partnering with your doctor. Let me start by being clear that dizziness is common and often benign, because that's reassuring and true. Dizziness is one of the more common complaints in older adults, and it has a great many possible causes, the majority of them not dangerous. It can come from the inner ear, which governs balance, as in the common condition where certain head movements trigger brief spinning, called BPPV, which I've discussed, or other inner ear issues. It can come from dehydration, which I've discussed as common in older adults. It can come from medications, since many medications, including some for blood pressure, and others, list dizziness as a side effect. It can come from standing up too quickly, and the blood pressure dropping, the orthostatic dizziness I've discussed. It can come from being unwell, from anxiety, from low blood sugar, from vision or neck problems, and from many other usually benign causes. So dizziness is common in older adults and usually has a benign cause, the inner ear, dehydration, medications, standing too quickly, being unwell, anxiety and more. Which is reassuring though, as I'll explain. Certain patterns and accompanying signs make it worth getting checked. So much dizziness is common and benign, which is reassuring, but some patterns matter. So dizziness is usually benign, which is reassuring. So understanding the common benign causes provides reassurance. Let me explain the heart and circulation connection, because this is the part worth understanding and the reason some dizziness matters. Dizziness can sometimes relate to the heart, the blood pressure, or the circulation, in ways worth knowing. First, and most commonly, dizziness on standing up, as I've discussed, comes from the blood pressure dropping when you stand, orthostatic hypotension, so that the brain briefly gets less blood, causing lightheadedness, which is often related to dehydration, medications, or aging blood pressure reflexes, and matters partly for the fall risk it brings. Second, dizziness can sometimes relate to the heart not pumping effectively, or to a heart rhythm problem, an arrhythmia, where the heart beats too slowly, too fast, or irregularly, so that the brain doesn't get steady blood flow, causing dizziness, lightheadedness, or even faintness. And this is an important potential cause worth identifying. Third, dizziness can relate to blood pressure that's too low, or sometimes issues with the circulation. So dizziness can relate to the heart and circulation through blood pressure drops on standing, through heart rhythm problems where the heart doesn't maintain steady blood flow, and through low blood pressure or circulation issues, which is exactly why certain dizziness, especially with particular features, is worth getting checked, to identify any heart or circulation cause. So the heart and circulation connection, especially rhythm problems and blood pressure drops, is why some dizziness matters. So dizziness can be a heart or circulation signal. Let me be clear about the patterns and accompanying signs that make dizziness worth checking, because distinguishing benign from concerning is the practical heart of this. While much dizziness is benign, certain features make it worth getting checked. Dizziness accompanied by fainting or near fainting, actually passing out or nearly doing so, is an important feature warranting attention, since it can relate to the heart or blood pressure. Dizziness with palpitations or an irregular or racing heartbeat warrants attention, since it can suggest a rhythm problem. Dizziness with chest pain, severe breathlessness, or other heart symptoms warrants urgent attention. Dizziness that's severe, sudden, recurrent, or persistent warrants checking. Dizziness with stroke-type signs, sudden numbness or weakness. Trouble speaking, vision trouble, severe headache, or trouble walking is a stroke emergency, as I've discussed with FAST, and dizziness causing falls warrants attention for the injury risk. By contrast, brief, occasional lightheadedness on standing that quickly passes, or clearly tied to a benign cause, is more likely the benign kind, though recurrent standing dizziness is still worth mentioning. So dizziness with fainting or near fainting, with palpitations or an irregular heartbeat, with chest pain or breathlessness, that's severe, sudden, recurrent or persistent, with stroke signs, or causing falls warrants attention, while brief lightheadedness that quickly passes is more likely benign. So the accompanying signs, especially fainting and palpitations, distinguish concerning dizziness. So knowing which features matter is the practical key. Let me be especially clear about the urgent situations, because some dizziness is an emergency. Seek emergency medical attention if dizziness comes with signs of a stroke, sudden numbness or weakness especially on one side, trouble speaking or understanding, vision trouble, severe headache or trouble walking or loss of coordination. Remembering fast, since dizziness can occasionally be part of a stroke, chest pain, pressure or tightness, severe breathlessness, fainting or loss of consciousness, or a severe sudden dizziness unlike anything before, and seek prompt medical attention for dizziness with fainting or near fainting, with palpitations or an irregular heartbeat, or that's recurrent or persistent, to identify any heart rhythm or blood pressure cause. So dizziness with stroke signs, chest pain, severe breathlessness, or fainting is an emergency needing immediate care, while dizziness with near fainting, palpitations, or that's recurrent warrants prompt medical attention. So know that dizziness with stroke signs, chest pain, breathlessness, or fainting is an emergency, and dizziness with near fainting or palpitations warrants prompt checking. So recognizing the emergency dizziness is vital. Let me explain why heeding the concerning kind matters, because it can catch important things. Heeding dizziness with concerning features matters because when it relates to a heart rhythm problem, identifying and treating that, like the atrial fibrillation or other arrhythmias I've discussed, can address the dizziness and, importantly, reduce risks like stroke. When it relates to blood pressure drops on standing, addressing the cause, often dehydration or medications, reduces the dizziness and the dangerous fall risk. And when dizziness is a stroke sign, recognizing it and acting instantly can save life and prevent disability. And dizziness causing falls is itself a major hazard in older adults, since falls can cause serious injury, so addressing dizziness helps prevent falls. So heeding dizziness with concerning features matters, because it can catch and treat heart rhythm problems, blood pressure issues, or a stroke, and can reduce the serious fall risk that dizziness brings, whereas dismissing concerning dizziness as nothing can miss an important cause or lead to a dangerous fall. This is exactly why, while much dizziness is benign, understanding which kinds matter and getting them checked is worthwhile. So heeding concerning dizziness can catch important causes and prevent falls, so heeding the concerning kind genuinely matters. Let me give you what to do and what helps, because there's both action and sensible measures. First, for dizziness with concerning features, with fainting or near fainting, palpitations or an irregular heartbeat, that's severe, sudden, recurrent, or persistent, see your doctor to find the cause, since it can relate to the heart, rhythm, or blood pressure. And seek emergency care for dizziness with stroke signs, chest pain, severe breathlessness, or fainting. The doctor will ask about your dizziness when it happens, what it feels like, how long it lasts, and accompanying symptoms, examine you, check your heart, pulse and blood pressure, including on standing, review your medications and do tests like heart tracings or others as needed to find the cause and treat it. Second, for benign dizziness, sensible measures help. For dizziness on standing, rise slowly in stages, stay well hydrated, and have medications reviewed as I've discussed. Stay hydrated generally, and review with your doctor whether a medication is causing dizziness without stopping it on your own. Third, whatever the cause, take care to prevent falls when dizzy, sitting or holding on until it passes. So see your doctor for dizziness with concerning features and urgently for emergency signs, while managing benign dizziness with slow rising, hydration, and medication review, and taking care to prevent falls. So get concerning dizziness checked, manage benign dizziness sensibly, and prevent falls, so the action depends on the features. The OI. Let me paint you a picture of how this plays out both ways. First, picture a woman in her 70s who gets brief lightheadedness when she stands up quickly, which passes in a moment, with no fainting, palpitations, or other symptoms. This is most likely the benign orthostatic kind, and she manages it well by rising slowly, staying hydrated, and having her medications reviewed, with no cause for alarm, though she's careful not to fall. That's the common, reassuring case. Now picture a man in his 70s who has episodes of dizziness that come with his heart racing or feeling irregular, and once nearly fainted. This combination, dizziness with palpitations and near fainting, points toward a possible heart rhythm problem. So wisely he sees his doctor rather than dismissing it, and is found to have an arrhythmia, which is then treated, addressing his dizziness and reducing his associated risks, the dizziness having been a signal that heeded led to catching an important heart cause. And in an emergency version, dizziness with sudden weakness, slurred speech, or severe headache would be a stroke needing immediate care. The contrast shows the value of distinguishing benign dizziness from the concerning kind, heeding the features that matter. So distinguishing and heeding the concerning dizziness caught his rhythm problem. And let me speak directly to those of you caring for or close to an older person, because dizziness is common, easily dismissed and sometimes important. You might notice a loved one experiencing dizziness, unsteadiness, or near faints. You can help by understanding that while much dizziness is benign, from the inner ear, dehydration, medications, or standing too quickly, some can relate to the heart, a rhythm problem, or blood pressure, and matters. So watch for the concerning features, dizziness with fainting or near fainting, with palpitations or an irregular heartbeat, that's severe, sudden, recurrent, or persistent, and encourage seeing the doctor for those. Crucially, know the emergencies. Dizziness with stroke signs, remembering fast, chest pain, severe breathlessness, or fainting needs immediate care. For benign dizziness, especially on standing, support slow rising, good hydration, and medication review with the doctor. And importantly, help prevent falls, since dizziness is a major fall hazard in older adults, by encouraging sitting or holding on when dizzy and keeping the environment safe. Helping a loved one distinguish benign dizziness from the concerning kind. Get the concerning kind checked and stay safe from falls can catch important heart or circulation causes and prevent injury. So your help distinguishing and acting on concerning dizziness genuinely helps. Let me draw this all together. Dizziness is common in older adults and usually benign. From the inner ear, dehydration, medications, standing up too quickly, being unwell, anxiety and more, which is reassuring. But some dizziness carries an important message about the heart or circulation. Dizziness can relate to the heart and circulation through blood pressure drops on standing, through heart rhythm problems where the heart doesn't maintain steady blood flow to the brain, and through low blood pressure or circulation issues. The features that make dizziness worth checking are fainting or near fainting, palpitations or an irregular heartbeat, chest pain or breathlessness, dizziness that's severe, sudden, recurrent or persistent stroke signs, or dizziness causing falls, while brief lightheadedness that quickly passes is more likely benign. Dizziness with stroke signs, chest pain, severe breathlessness or fainting is an emergency, while dizziness with near fainting or palpitations warrants prompt checking. Heeding concerning dizziness can catch and treat heart rhythm problems, blood pressure issues, or a stroke, and can reduce the serious fall risk. So see your doctor for dizziness with concerning features. Seek emergency care for the emergency signs. Manage benign dizziness with slow rising, hydration, and medication review, and take care to prevent falls. So here's what I'll leave you with. First, understand that dizziness is common in older adults and usually has a benign cause, the inner ear, dehydration, medications, standing up too quickly, being unwell, or anxiety. So it's often not cause for alarm. Second, understand the heart and circulation connection. Dizziness can sometimes relate to blood pressure drops on standing, to heart rhythm problems where the heart doesn't maintain steady blood flow to the brain, or to low blood pressure or circulation issues, which is why certain dizziness is worth checking. Third, recognize the features that make dizziness worth getting checked. Dizziness with fainting or near fainting, with palpitations or an irregular or racing heartbeat, with chest pain or breathlessness, that's severe, sudden, recurrent or persistent, or that causes falls, all of which warrant seeing your doctor to find the cause. Fourth, and urgently, know that dizziness with stroke signs, sudden numbness or weakness, trouble speaking, vision trouble, severe headache or trouble walking, remembering fast or with chest pain, severe breathlessness or fainting, is an emergency needing immediate care. And fifth, manage benign dizziness sensibly, rising slowly in stages, and staying hydrated for dizziness on standing, having medications reviewed by your doctor without stopping them on your own, and taking care to prevent falls by sitting or holding on when dizzy. Dizziness is usually benign but sometimes carries an important message about the heart or circulation. So understanding the difference and heeding the concerning kind while managing the benign kind and preventing falls is genuinely worthwhile. So take care of yourself, understand your dizziness, manage the benign kind, get the concerning kind checked, and stay safe from falls. And because identifying and treating a heart, rhythm, or blood pressure cause of dizziness requires a doctor, and some dizziness is an emergency, please treat dizziness with fainting, palpitations, or that's recurrent as your reason to see your own physician, and dizziness with stroke signs, chest pain, or fainting as your reason to seek immediate care, rather than dismissing concerning dizziness as nothing.